Thank you very much for sticking around. It's Medical Monday, and I'm here with Dr. David McLaughlin right now. He's an interventional cardiologist at RMH, and we're talking about cardiovascular disease. Tell us what we need to know.
Well, some of the things you need to know about cardiovascular disease is that it's the #1 killer in the United States, actually around the world. And there are men and women are at equal risk, and there are a number of risk factors that you need to know of to see if you're at risk yourself. There are modifiable risk factors and risk factors that are not modifiable. The modifiable risk factors are really obesity and its sequela, diabetes, hypertension, high cholesterol, and smoking, which is a big one in the Valley. And then the non-modifiable risk factor, of course, is your family history.
Okay. So make sure I guess exercise is probably big. Definitely
Huge.
Stop smoking, especially if you have a history of problems.
Absolutely.
Okay.
Absolutely.
And what are some signs then for someone who may be more likely to suffer a stroke or had somebody in the family that had a heart attack?
The symptoms of a heart attack, again, boil down to two different types. There are typical symptoms and atypical symptoms. The typical symptoms of a heart attack everyone knows, pressure in the chest, crushing chest pain, radiation to the arm. But more and more we're seeing people with atypical presentations. They have indigestion, they have some jaw pain, maybe isolated pain in their arm or between their shoulder blades, and they make it a little more difficult.
Okay, but you can be screened though too, right?
Absolutely.
That's one thing that RMH offers. So we could pull up that board real quick. Remember Dr. McLaughlin here, he actually deals with you after the screening, I guess, if they do find a problem.
Correct.
Now you can actually get the heart health screenings. They're offered at a reduced rate of $50. To register, call RMH. The number's right there on your screen. It's the Health Source at 433-4500. And to go over some of the things then, so you get screened and then you see, okay, maybe I might be maybe more likely, I guess, than most people to be dealing with something like this in the future. What can you tell us about catheterization, stents? What's the difference, and what are some of the possibilities for people?
Sure. Well, the way we diagnose coronary disease, there are two basic mechanisms. One is through stress testing, which is completely non-invasive, and that's usually where we start. If a stress test is abnormal or equivocal, we'll usually recommend another test like a cardiac catheterization, which is an invasive test whereby we enter the circulation in the artery in the leg and thread catheters back to the heart. The catheters are about 1/10 of an inch in diameter. Once we're in the circulation, the patient doesn't feel anything. And we inject dye in the coronaries, which allows us to delineate the blockages and tell us how it's best that we treat them.
And now what about a stent?
Coronary stents are devices that are basically made out of metal, cobalt, chromium, really. And they're scaffolding devices that allow us to open the coronary arteries and keep them open for prolonged periods of time. There are two basic types of stents. There are bare metal stents and there are medicated stents. And medicated stents are new over the last decade, and they really are a tremendous improvement on how we treat coronary disease. Blockages rarely come back within medicated stents, whereas they would come back maybe a third of the time in bare metal stents. So they've really revolutionized the treatment of coronary disease.
Thank you very much for joining me.
Sure.
I really appreciate it. Definitely
Sure.
an education for everyone at home, whether or not they have a problem or not. Help out friends and family. I really appreciate it.
You're welcome.
Okay, cool. Well, definitely.